grew up in Iowa for the most part. Went to high school in Des Moines, went to the University of Iowa for undergrad and dental school. While I was in dental school, I joined the Navy and spent about 3 years in the Navy and had a great experience with that. And when it was time to move on from the Navy, there was an opportunity here in Ames to join Dr. Paul Reedhead, was my mentor, and so I had joined him here, and we worked together for about 10 years before he retired. I remember back in middle school, my mom had a lot of TMJ problems and headache problems, and ended up seeing a dentist and had a full mouth reconstruction. And so I have that memory of middle school, but it really didn't come back to me, I guess, until I was my junior year of college and had a situation where I had to get a tooth fixed in Iowa City, and had a great experience with the dentist and the dental assistant. I mean, I think there was a good song on the radio, and I walked out there and thought, I think I can do that. I like the idea of working with my hands and doing something tangible, being able to help people, and whether it's a big way or a small way. So we have a set of core values that help guide our decisions and what we do, and one of those that our team has agreed on is generosity. And so, at the end of the day, you can fill teeth, you can clean teeth, you can do all the dentistry, but there's more reward in being a bigger part of the community and being part of something bigger than yourself. And service and acts of service is one of my love languages I've discovered, and so that's just part of who I am and what I've done through my life, and I just want our practice here to parallel that in terms of being able to help and have that ripple effect, not from our patients to our team, but out into the community. I have lots of interactions with patients every day that I think are really fulfilling. I really love having a patient who's maybe had a really bad experience in the past and pretty high fear, and being able to talk with them in a way that gets them through that, so help them find a way through some of that fear and uncertainty, and sometimes just talking about it and getting them, even if it's just to do something simple. We have a lot of patients where we get them through that barrier, and then going forward they don't have as much anxiety. So I don't always have necessarily a favorite procedure, but I do really enjoy almost the challenge of that, is helping somebody through getting to the point where going to the dentist or coming here is not that big a deal. And we have a lot of patients where we've been able to do that. I think we treat people the way we would want to be treated, and when you've been places where you've had average service, and you've been places where you've had above average or beyond your expectations, that's what we're striving for. It's not perfect, but we're always trying to make the experience better for people than it has been in the past. And so that's why routinely we offer a comfort menu that has a dozen things on it that you can choose from to make your experience here as pleasant as it can be. Our job is to do the dentistry and do it at a high level, and the patient's job is to be able to sit back, relax, and let us do what we do.